Hi, everyone, and welcome back to the Missing Pet Consultant Certificate Program. Today we're starting Course 2, Missing Pet Prevention and Recovery in the Animal Shelter. Module 1, or Module A, Pet Overpopulation. So many of you in the audience probably work in animal shelters as an employee or as a volunteer. You may be a community partner, or you may be someone else completely different. You may be some other kind of animal care professional like a pet sitter or dog groomer or a TNR person. It's very critical for all of you to understand how the animal shelter system works. Even those of you who are working in it may not realize all the complexities that exist across the country. It can be a very confusing system, even for those of us who are familiar with it, let alone the pet owner who may have never entered an animal shelter in their life. So today we're going to talk about pet overpopulation. This is a huge buzzword or buzzwords that you'll hear in animal welfare all the time about pet overpopulation. I did a search this morning on the term pet overpopulation just to see what would come up, and it was very interesting. I don't want to point fingers at any organizations, but a lot of the big orgs came up with a page talking about pet overpopulation and saying that it's the fault of people who don't spay and neuter, and people who abandon their pets. But today I'm going to tell you that there's really a very different and very obvious reason that we are ignoring completely. Well, let's start with the definition. Now, all my life, I've kind of been a nerd. I like to look stuff up. When I was a kid, my grandmother would tell me to go look it up in the dictionary, right, before internet. We had dictionary, and we had that giant set of encyclopedias. So I would look stuff up. She wanted me to learn for myself and to think critically, which is the same thing that we're going to talk about today. So I'd grab that big dictionary and look it up. Got to start with the definition. So here's a couple from some different dictionaries that I found online. Don't have to have the big book anymore, although I think I still have it in the garage somewhere. Merriam-Webster calls it the condition of having a population so dense as to cause environmental deterioration, an impaired quality of life, or a population crash. That's a pretty big definition there. And dictionary.com has a shorter and simpler definition, which simply says the condition of being populated with excessively large numbers. Okay, let's start there. What is excessive? Yes, that's my bed, and there are more cats in the house. So what is excessive? This is a very esoteric term. What does that mean? What is enough? What is too little? And what is too much? Now we're looking for another definition. Is the environment for pet animals, dogs, cats, primarily other animals, being deteriorated by their presence? So I think now we start to understand that a lot of these definitions exist for wildlife and unfortunately also for people when you're talking about population density. So it's not numbers, it's actually a density. For example, people who live in a big city, people who live in a slum, you have a high density of people. So therefore, the environment is more heavily impacted in that particular area. So is their environment being deteriorated? You know, not that I can see. Some may claim that cats kill wildlife, but this is actually a very small impact on a small area. None of this predation has an effect on the population overall, despite what some folks may claim. Is their quality of life impaired by their population? Not by their care or their conditions, but simply by their population. Are there so many dogs and cats out there that they're starving to death, that they can't get the resources they need? Now, in some parts of the world, they are, where you have free breeding populations. You'll see some in around South America, in Mexico, different parts of the world, where also people are very poor and don't have resources to care for themselves. There's not a lot of resources to care for free-roaming animals. So you have packs of dogs living in dumps, in places like that, and freely roaming and breeding and doing the best they can. But generally, across the U.S. and in most of the world, this is not the case. These conditions exist in isolated areas. So it's not that they are necessarily overpopulated, it's that the conditions for everyone in the area are difficult. Are they experiencing a population crash? So we're just picking apart that definition due to the environment's inability to sustain them. Is that happening? Are they actually dying of starvation and disease because the population can't sustain them? Now, we certainly see this with wildlife, and ironically, we see it in areas where human beings interfere. We want to manage wildlife. And where we see this quite often is in ungulates, like deer, like elk, like other kinds of animals like that. These are animals that live in groups, and they graze and forage, and they are hunted by predators. Well, in a lot of the country that is developed, there aren't a whole lot of predators. They've been hunted, they've been driven away, their habitat's been taken away. Just driving around my area where I live, everywhere you look, you see a deer. There are hundreds of them, and they all look pretty fat and healthy to me. But in other areas, for example, there was a big issue some years back with, I believe it was elk, that were overpopulating in another state. It was not in California. And people were feeding them because they meant well. They wanted to help the animals, so they were putting out hay and other feed. Well, the animals started congregating and coming into town and begging for food. And so consequently, some of them were hit by cars. They spread disease because there were excessively large numbers coming together and eating this food. And so it was not their natural processes, but human interference that caused the population density to go up. Now, if a certain type of animal is overpopulated, so what is the correct population? And I don't think anybody can answer that. And I want to know, it's of course interesting in wildlife, and I'm sure wildlife biologists could give us some estimated numbers, but even they don't know how many animals are actually out there. And in the cases of cats and dogs, we have the estimates from the American Pet Products Association primarily, but those are owned pets. We don't have any idea how many free-roaming cats are out there, or just how many pets are out there in general. All we have are rough estimates. So how do we know what the correct population is? We really don't. So here's the real problem. Companion animals are overpopulated in animal shelters, not in their communities. And I would prefer to say they are overcrowded, not overpopulated, because remember, it's not how many there are in existence, it's that population density. You pick up unlimited numbers of animals and stick them all in the same building without any kind of regulation, you're going to have overcrowding. And unfortunately, this is happening all across the country. You have to remember that shelter populations represent less than 5% of the pets in any given area. Let me repeat that because it's extremely important. Shelter populations represent less than 5% of the pet animals in any given area, so they are not a mirror to the community. Not. It is a representation of that shelter's policies, of their facility, and of their ability to care for the animals that they take in. It has nothing to do with the public. So why is this happening? I mean, don't we think that animal shelters started to help animals? Did we really start out with the intention of just putting together some buildings and housing animals so that they became stressed and sick and ultimately end up largely being euthanized? Well, there's a whole history which I will give you some more information on that later that we don't have time to get into today. But unfortunately, the history of animal sheltering does kind of have two tracks. There's one track that was simply the pound, where it involved picking up animals who may be rabid or may bite people, etc. And then there's sort of the Humane Society track, where folks wanted to prevent animal cruelty and experiments on animals and things like that. And when those two collided, we have sort of the model of the shelters that we have today. But there's always that kind of dichotomy between care and control, and we still haven't quite balanced that out in today's world. But I'm going to ask why. Why does this keep happening? Let's explore that. Well, I think the first and most important thing to talk about is that there is a lack of policy review. And when I made this slide, I wondered whether to put lack of knowledge first, but then I decided not to, because it's not like the knowledge isn't out there. It's out there. It's been out there for probably 10 years or more. What needs to be done to prevent this from happening? But many folks choose to ignore that and claim, well, that won't work for our community. That won't work for our shelter. And so they don't review their policies. And you get into a lot of this, I'm sure, in other types of agencies as well, but especially in animal sheltering. And we'll talk about that more in the next module when we talk about shelter culture. You get into that, that's the way we've always done it, we can't change, people in the community won't like it, and that won't work for us. And that's just absolute rubbish. So then these practices continue year after year, and of course nothing ever changes. And there is a lack of knowledge. So despite all the online trainings today, all the conferences, all the expos, everything that's out there, all the initiatives, Maddie's Fund, Million Cat Challenge, ASPCA, HSUS, all this efforts to educate, still many of the shelter leaders in this country simply don't know. And it alarms me every time I go to a conference. I hear people say things like, for example, last year a man said that they were still euthanizing cats at their shelter for testing positive for FIV on a SNAP test. And that has not been a best practice for years. So this kind of ignorance exists all over. And people just keep doing it without questioning, without seeing what are the best practices and the latest things, which if you were in a for-profit business, of course you would be on the forefront of that. But in nonprofit, we tend to fall into this rut of continuing to do things the same way and not questioning the way we are doing things. There is no regulation of intake, and this is huge. People will argue until they're blue in the face that they cannot, quote, turn people away. We can't turn people away. They're going to shoot the animals. They're going to throw them in the river. Okay, we'll talk about this more in another module. But the bottom line is when you don't regulate your intake, you're going to have a problem. Now try and imagine that you're at a hospital. And one of the shelters I worked for was under the health department. So I learned a lot of interesting things about the health care system, which is not a system in which I have worked. So previously I didn't know anything about it. And they've made a lot of positive changes, but I'm going to talk about a ridiculous example that does not exist, just to give you an idea of how crazy it is what we do in animal sheltering. So let's say there's a hospital, okay, and everybody who comes to the hospital gets admitted, whether they have a cold, whether they have a stomach ache, whether they need surgery, they're about to have a baby, anything. Nobody's questioned, nobody's turned away. They're just immediately admitted to the hospital and given a bed. Okay, so what do you think is going to happen? Pretty soon, all the rooms are going to be full. So now other people start coming, and they really need help too. So we start putting multiple people in the same room. And then that starts getting overcrowded. So now we have 3 or 4 people in each bed. And we have people mixed up in the rooms. You have someone with tuberculosis sharing a room with a healthy woman who's about to have a baby, or someone with hepatitis, or the flu. These people are all together in the same room or sleeping in the same bed. And then the workers start to get overworked, and they say, well, we can't provide care for all these people. There's 5 times more people here than we have the ability to care for. So they start not changing the bedding, and they start skipping feedings and medications. Mistakes are made. Things get missed. People get worse. People die. And then ultimately, the administrators say, well, there's just too many people here. We have to start killing them to make room for the new ones that are coming in. Sound totally wacko crazy? This is what we do in animal sheltering every day, and we don't question it because we don't understand capacity for care. And this is something, it's in your materials. You can learn all about it. It's a very basic principle. How many animals and under what condition can you care for at any given time in your facility? There's an answer for everybody, and you have to stick with that, or else all you're doing is causing harm. Long length of stay. This is another big one in animal shelters. And it's interesting, I've helped some shelters kind of do a timeline to figure out where the blockage is. Where are these animals getting hung up in the timeline? And for many of them, it's the processing to get them up for adoption. And this is surprising to me. It's not because of lack of resources or money or willing adopters. It's that shelters have created these complicated processes where animals have to have a health exam. They have to have a behavioral evaluation. They have to be spayed or neutered before they go up for adoption, which is totally understandable. But when that causes an animal to sit in the kennel for 2 or 3 weeks waiting for those things to happen, there's a breakdown in the system. So something has to change. And the answer is different for every agency. It may be taking in fewer animals. It may be hiring another vet or engaging someone else to help with the spay-neuter. It may be skipping the behavioral evaluation unless there's a very real concern, because that practice has been found to not be especially helpful in regard to adoptions. It may be skipping some of the medical tests that are now unnecessary, like the SNAP tests for FIV and FELV. Those are really not helpful unless the animal is clinically ill. So you need to examine those processes to get the animals in and out as quickly as possible. Now, I'm interested in learning more about hotels because, again, that's a for-profit industry, and they've got this stuff dialed in. They have some different formulas for their occupancy rate throughout the year, and it's very similar to animal sheltering. Let's say you have 50 rooms, and some of them are full. Some people stay for 1 night. Some people stay for 7 nights. And so you have sort of a formula that you figure out when are you full and how full are you, and at what times of the year can you take on more people to stay in your rooms. And it's pretty simple, but it's not something that's often done in animal sheltering. And when you look at those care days, you have to figure out if we have an animal coming in and staying for 3 or 4 days, that's great. If you have another one coming in and staying for 30 days, that's how many other animals that could have been brought in during that time. So these are all things that you need to look at. Now here is some of the more behavioral stuff that is extremely damaging. And one of those factors is learned helplessness. This is a big one. I swear I see this everywhere I go. People are just not empowered. They throw up their hands and say, people are irresponsible, people abandon their pets, we're full, we can't do anything about it. Of course you can do something about it. Why are you even there if you believe this? But it's a learned helplessness. People start making themselves the victim rather than the owner whose pet is lost and now they can't find them or get them back for any number of reasons. So this is very destructive behavior that's extremely common in animal sheltering. There are false arguments, and there will be a link to the common logical fallacies in your follow-up assignments. There are many arguments, like, for example, back in the day in the late 80s, I used to have a bumper sticker that said, if you're not part of the solution, you're a part of the problem. And it was from our local Humane Society where I worked at the time. We blamed the public for everything. Then there was the until there are none, spay or neuter one. That's especially ridiculous because with all the numbers of animals out there versus the 5% or less coming into the shelter, you're not reducing the population by spaying or neutering an animal here and there. Now, don't misunderstand me. I'm not saying that spay-neuter isn't critically important for the health of a community's animals, but it is not overall reducing the population, and it certainly isn't reducing the shelter's population. And blaming the public. Again, if you blame someone else, that takes all the responsibility off of you. So that might feel good for a minute, but what it means is nothing's going to change. And is that what you want? Or do you want things to change? Do you want things to get better? And that's hard. You can look at yourself in anything, in your home life, in your relationships. Can you say, what can I do differently? What am I doing wrong? And that's not a bad thing. You want to question it and say, can I try something else? Can I try to think differently? There's no guarantee it's going to work, but try. Don't stay in that rut. The missing pet problem. So here we get to the crux of the matter, the real problem for animal sheltering. So I'm here to tell you the pet overpopulation problem is actually the missing pet problem, okay? Because generally, under the definitions that we're studying today, pet overpopulation per se is a myth. There are not hordes of pets running around, free roaming, starving to death, degrading their environment. This is just not happening. In 99% of the world, this is not happening. It's actually a missing pet problem. And let's talk about what that means. So here's the situation. So pets are picked up, whether it's a cat sitting in front of their own house, and this happens a lot, or a dog that maybe got out of its yard and has taken himself for a walk, or jumped out of a car, or broke the leash, or any number of ways that a dog becomes at large. So let's say they're picked up and taken to a shelter. And of course, there are many other outcomes. They can be found, they can be kept by a finder, they can go to rescue. There's any number of other outcomes, but let's just say the outcome is that they're taken to a shelter. Okay, but then the owner doesn't find them and doesn't reclaim them for any number of reasons that we'll talk about more. Either they don't know where they are, or they don't have the money for reclaim, or whatever. Many reasons. They don't reclaim their animal. So now the shelter has the animal. So what happens now? Well, if it's a shelter that's able to not euthanize the animal, they will stay in the shelter. They'll be available for adoption, and they may be there for days, weeks, months, or even years in the cases of some shelters where animals pretty much live there. They may be transferred to another shelter or a rescue group, where then that group will start all over again with the adoption process, whether it's at a shelter facility or at the store, pet fairs, or anything like that. So this is a long process. This animal is now in the system and may be there potentially for years. The owner eventually stops searching, some quicker than others, some continue for months or even a year, and eventually give up because they get no leads, they don't find their animal, because their animal's not in the community anymore. It's been absorbed into the system. And then, what does the owner usually do? They get another pet. So how did that help reduce the population? Yeah, it didn't. So please don't misunderstand me. I'm not saying that adoption programs are bad. Adoptions, fostering, spay, neuter, all of these amazing life-saving programs are great and should be supported in your community. But the point I'm making today is that these adoption programs, in many cases, are only perpetuating the missing pet problem by focusing on the adoption track instead of trying to find the owner and get that pet back with their owner and keep them there. By only focusing on adoption, these animals are owned pets. The majority of these animals are owned and loved pets that are being brought into the system for any number of fates. They could be euthanized, they could be held for adoption for very long periods of time. And now they're being placed into a new home. And so now the owner is just going to get another pet. So it's not like we've made any impact on the population at large, which is why things never change. Year after year after year and decade after decade, all the same animals keep coming in every year. Now, I'm not saying that animals aren't treated badly, neglected, or abandoned. They certainly are. But those cases are so in the minority that unless we have verified proof, we need to understand that the majority of pets entering shelters are owned and loved pets. And we need to be making every effort to find that owner and get the pet back. So the next person who comes into the shelter wanting to adopt can adopt an animal that doesn't have a home, one that was brought in as a kitten, as a sick or injured animal needing care. Maybe the owner passed away. There's any number of reasons why these animals could really, genuinely need a new home. Now here's another level of crazy for you. So people are talking out of both sides of their mouth. On the one hand, they're saying we have an overpopulation problem. Yet it has been proven that rescue groups are buying puppies to meet the need. And there's an article about this in your materials. Now, I think it started out as a good thing where rescue folks were going to these horrible auctions where commercial breeders, puppy mills, are selling their puppies. And there are hundreds and thousands of puppies that are sold, taken to the various pet stores around the country and sold there for an inflated price. And I believe originally their intent was maybe to buy the mother dogs that were no longer wanted, those who needed medical care, who would have had a bad outcome if not taken by the rescue. But at this point, there's such a demand for puppies, and they can bring such a high price that the rescues have basically, in many cases, turned into a pet store. That they're buying animals and bringing them in and adopting/selling them. Others are bringing in dogs from other areas. And I can understand the desire to do this when you go to a place where the shelters are terribly overcrowded and the only outcome for these animals will be euthanasia, or when you go to a place where there is a dog meat farm, or a place like, say, Mexico City, or places where there really are populations of free-roaming dogs that are in terrible condition. It seems very rewarding to bring them back and treat them. But how can we say that we have overpopulation when we are now bringing in more animals? And we have a problem with that. This is not only increasing the population, reducing the ability of the animals in this community to stay in their homes or to be adopted if it's necessary for them to have a new home. A lot of these animals are coming with different diseases and behavioral issues that we haven't seen in the United States. And we're getting a lot of calls about missing dogs, especially from the Asian countries. Many of these dogs are genetically very different, certain breed types, and extremely skittish. And people are bringing them home and they're getting away and they're not coming back. So this type of practice is causing all sorts of issues. So what now? Okay, hopefully I've opened your eyes today and you're going to start thinking about these things more. But now what do you do with this knowledge? Where do you go from here? How do you make a difference? Well, as Abe Lincoln said, or didn't say, I want you to think critically. My goal is not to tell you what to think or what to do, but to empower you to get rid of that helplessness, to think critically and start really examining the practices around you, whatever your role is in the community. Okay, so I want you to question everything. Everything. Don't make assumptions. This is how we've lived for decades, and how's that working for us? It's not. I want you to think logically. That's really hard sometimes. Look at things and say, well, we always believed that these dogs that came in looking scruffy and dirty were abandoned, but what proof do we have that that's happening? Could it be that this dog has been on its own for a couple of weeks, and this is a dog that maybe has a health issue or is a type of breed that needs grooming, and after 2 or 3 weeks they're going to look pretty bad, and that's not indicative of what happened in their home? You got to have this thought process. Look for the truth. And there may not be only one truth, but you got to look for it. Draw your own conclusions, and then question them again, because you may be wrong. As in the example of the dog that may have been out on its own for a month. Okay, say, well, that's a possibility. That's a logical possibility. But what else might have happened? And continue questioning. You have to do that. So just like old Smokey the Bear says, only you. Okay, he's talking about forest fires. We're talking about animal welfare. But only you can make this happen, not somebody else. This is not somebody else's problem. Because we know now that much of what we've been taught is a myth. They're just myths, beliefs, biases, prejudices, with zero basis in fact. So I want you to get out there and look for the facts. Find the truth, and only through that way can you